proceed with the press statement. Then good morning once again, colleague. As the Uganda Cancer Institute, wishes to draw the national attention on the growing burden of oesophageal cancer in the country, and therefore we are urging the public, the healthcare professionals, and the policymakers to prioritize intervention that seeks to reduce the risk of developing oesophageal cancer in this country, and also intervention that seeks to improve diagnosis and access to treatment of this threatening disease in the country. And over decades, Uganda Cancer Institute has observed through the data, we keep monitoring our cancer data, we have observed a growing burden in the number of patients presenting with oesophageal cancer in the country. As the ED has already alluded to that, it is now the 5th leading cancer in terms of number of cases. And then in terms of number of deaths, it is competing with cancer of the cervix neck to neck, just following cancer of the cervix as number 2. So that is very worrisome. And then when you look at the outcome of the treatment, many other cancers, if you find them early, through the screening intervention, you can treat and cure them. But esophageal cancer is one of those cancers which the screening tests are still being developed. You can do some early diagnosis, but not like a widespread like the way you screen for cancer of the cervix and maybe cancer of the breast. And therefore, it is posing a problem whereby majority of the patients are coming with advanced disease, as ED already mentioned, where whether you treat, you can provide some treatment, but saving life can be very hard. And yet you can do something to find this cancer early enough. And some of these interventions are lacking in our primary care facilities to help in this early detection. For example, access to endoscopy and so on. So looking at this, we again look at the risk. What is available evidence in terms of what could be increasing the risk of developing esophageal cancer, and what could be fueling the high increment we are seeing over time. So a lot of research done. So high-level studies are showing that excess consumption of alcohol, and then use of tobacco, whether through chewing or smoking, and then drinking hot beverages over time, and then unhealthy diet, meaning when you don't mix your diet well, you don't eat varieties, and then you don't eat adequate amount of fruit and vegetables, the risk of developing esophageal cancer goes higher. Study has also shown people who live in houses which are poorly ventilated and also cook in the same houses. As you see in our country, you find 80% of the people living in rural areas, they don't have access to clean energy like electricity and gas for cooking, so majority are using firewood. So this firewood increases their exposure to this smoke, which continue irritating their esophagus over time and also increases the risk of developing esophageal cancer. All these things are things that we can reduce such exposures as individuals, as a government, as a communities, and so on. And then, apart from avoiding this to reduce the risk of esophageal cancer in the country, we can do some things in terms of early detection. Many of these cancers, we have their cancer survivors, meaning you have people who are treated and got cured and living free of cancer. But they became cancer survivors through screening, or where they are not screened, when they felt some symptom of the disease, they report it very fast to the hospitals. And that's why we have those success stories. And the same can happen for esophageal cancer. However, currently in the country, we have challenges in the primary care facilities. Because for esophageal cancer, to detect it, we need certain type of tests like endoscopy and maybe removing the sample immediately, which currently our level of the primary care facilities cannot undertake, except some of the regional referral and then the national hospital which can undertake that. That's why you are calling also all of us, even the healthcare professionals, even the policymakers, to prioritize access to some of those diagnostic interventions so that we're able to save our population from this bad disease.
Actually to get improvement in as far as outcomes are concerned. So what that means is that we as a government, we as the health workers, we must do a lot also on our side, and indeed we are actually doing. We want to increase our presence in as far as the grassroots is concerned, and that is why you have been hearing a lot of time we have been talking about our regional cancer centers that we are setting up. And of course, you are already aware that we have one functional one already in Gulu, and then we are setting up others in Bale, in Arua, and in Barara, and for that we already have funding, and the next thing which is needed is actually setting up. So in all this, prevention still remains actually the key thing that we need to do. And when we get engagements with people like yourself, we must explain to you things like what are the bases for people developing cancer. We call those risk factors. We need to explain them so that you can also bring it to the public so that they know about it.